All right, how's everyone doing today? My name's Chris Wallace, and I'm going to talk to you a little bit about general anxiety disorder. So let's go ahead and get started here. So, what is anxiety? Basically, anxiety can be defined as an emotional state that occurs as a threatening event comes close, and there's three major components to anxiety, which would be physical feelings, thoughts, and behaviors, and they're all kind of tied together. Physical feelings, you can see your heart's racing, dry mouth, sweating, shaking, things like that. And then thoughts, your mind is racing, and you're constantly worried that you're going to be harmed or you're going to lose control of a situation, which then manifests itself in behaviors, which leads to avoiding these situations where you're not in control anymore, or constantly asking if you're going to be okay, asking the people around you if you're going to be okay. So those are the three components to anxiety. And I thought it was also important to go ahead and talk about the different forms of anxiety as well, aside from general anxiety disorder, because there's many different disorders out there. So I thought I would touch on the major three that are most frequently seen. The first being panic disorder. This is when someone experiences panic attacks, but then they also have a constant fear or worry about when their next attack is going to come. And usually this is about a month or two of extreme worry. The second one would be social anxiety disorder. So it sounds just like what it is. Basically, you are constantly worried or scared of potentially embarrassing situations in public, in social situations, or performance situations like at work. If you have a presentation at work today and you're constantly worried about being embarrassed, you might not go to work because of your social anxiety disorder. You might avoid it completely. And that leads into the third major anxiety disorder, which would be social specific phobia. So what that is basically you have a irrational level of fear for something that has no harm to you. So if someone, for example, is afraid to touch a doorknob, maybe because they're afraid of the germs that might be on the doorknob. So those are the three major anxiety disorders I want to talk about just a little bit before we dive into what I want to talk about mainly today, which is general anxiety disorder. So there's some criteria that has to be met in order to be diagnosed with general anxiety disorder, and here are some bullet points here about the main criteria according to the DSM-5 for diagnosing mental disorders. So you have to have excessive anxiety and worry for at least 6 months, more days than not. So it has to occur for a while. So this is not something that just happens for a couple days. You have to have this ongoing for months at a time, and also your worry and anxiety has to be not easily controllable. So you really can't calm yourself down when you start to feel anxious. There's nothing you can do about it. It's just there. And then also too, the anxiety and worry that you're experiencing has to be causing significant distress to your life. So it has to be disrupting your life at work, has to be disrupting your social life, or any other performance situation in your life where it's really causing a huge issue with your performance and really kind of halting your life. And also that these anxiety and worry feelings that you're getting, they can't be due to another medical condition, so that has to be ruled out first. And it also has to be not better explained by another mental disorder, which I'll get into later. But general anxiety disorder is often not, it doesn't manifest by itself. You usually have some sort of other mental disorder as well, more often than not. So I'm going to get into that a little bit later as well. So building off that slide, you can see that there are six symptoms that you have to have in order to be diagnosed with a general anxiety disorder, and you have to have at least three or more of the six symptoms that you see here. What I thought was interesting as well when I was researching this is if you're a child, you actually only have to have one of the following six symptoms in order to be diagnosed. And the reason for that is children are more susceptible to things than adults, obviously. So for a child, having one of these six symptoms, that can be definitely causing a disturbance in their life. If they're having trouble sleeping or they have muscle tension or irritability, they're going to be more susceptible to that, and it's going to affect them a lot more than it would for adults. But for adults, you definitely have to have at least three or more of the following six symptoms that you see listed here in order to be diagnosed with a general anxiety disorder. So here are some interesting statistics that I found on general anxiety disorder. It says that 5.7% of the population will be diagnosed with this throughout their lifetime. So in other words, once you're diagnosed, 5.7% of the population, the symptoms are not going to go away. But you can see here there are some rare cases where, after a little bit, your general anxiety disorder is actually gone. And that can be through treatment, or maybe you had a bad patch and you just had a lot on your plate, and that's what was causing all these symptoms. But you can see here for lifetime prevalence, 5.7% of the population compared to the 12 months prevalence, which would be 3.1%. So you do see some situations that are rare where the individual will actually have the symptoms go away. And the onset of these symptoms generally occurs between the ages of 19 and 31, and often tends to be more common in females rather than males. I think a lot of that has to do with females maybe are more readily going to go ahead and seek treatment or help for these symptoms, when males tend to have a little bit of a bigger ego and don't want to be seen as quote unquote weak, even though this is a mental disorder. This is not a weakness, this is a real thing. But I think males are kind of hesitant to seek help. So that could lead to why it's seen more common statistically in females. And then in groups less than the age, younger than the age of 19, it actually has been shown to be equal in both boys and girls. For European Americans, as you can see here, they are actually at a higher risk for developing this disorder when compared to African Americans and Hispanics. You can see the European Americans have a 10.4% prevalence rate, while Hispanics and African Americans only have a 5.3%. So European Americans are actually at almost twice the rate at risk for this disorder when compared to those other groups. And as you can see here, general anxiety disorder, like I mentioned earlier, is actually commonly grouped together with other disorders as well at the same time, which makes it difficult to treat. So an individual with this disorder might also suffer from social phobia and depression at the same time, which makes things hard to prescribe a medication for if you have three disorders all at once. So that's why a mixture of different treatments, which I'll get into later, is important. And you can see here too that they often develop a substance abuse issue because they tend to use alcohol maybe sometimes to help bring themselves down to a calm level, which can lead to a dependency on alcohol. And they also tend to abuse their prescription medications because, as I'll talk about that more later, they tend to be sedatives that are extremely addictive. So you would have to be careful about that as well. So here are some interesting statistics that I found on a survey conducted about general anxiety disorder and how the general public views people with this disorder. I thought this was important to go ahead and throw this in here because this is a real mental health disorder and it should be taken as such. And as you can see here, reading these statistics, people either don't think that general anxiety disorder is a real thing, or they think that they're self-centered people, or that it's a sign of personal weakness. Even some have said here 6.6% of people with anxiety, general anxiety disorder, are viewed as having a personal weakness. So I thought that this survey really brought to light the fact that the general public doesn't really have a whole lot of information on general anxiety disorder, which is really why I want to talk about it today, to kind of really bring to light the fact that it is definitely a mental health issue and should be taken very seriously. Building off of that, you can see this graph here. What it says at the top, what people think anxiety feels like, and then at the bottom, what anxiety actually feels like. And then it goes ahead and it actually lists a lot of the symptoms that I had mentioned earlier on in the presentation here. I thought this was important because I think unless you have this disorder, you really don't understand what it really feels like to have it, and have to worry and have all this anxiety all the time for sometimes no reason at all. You're just keyed up, you have muscle tension, you can't sleep at night, things like that. So I think this was important because the general public has a stigma, obviously, as you saw on the last slide, and I think this really brings to light this is really definitely a serious mental health issue. So as you can see here, there are management and treatment options, and the most popular would be psychotherapy. The ultimate goal of psychotherapy is basically to help identify the underlying issues for someone who has this disorder. So it's not necessarily prescribing a medication, even though medication is sometimes used in conjunction with this form of therapy. It's really trying to get to the root of what's causing all this trouble for this individual. And a lot of times, too, they actually recommend complementary and alternative therapies, which would be yoga, meditation, stress management, and things like that. And these are really important to throw in because not only are they not invasive, but they're easy to learn, too, and they're healthy, and they're natural. So I thought that was important as well, that these two can be used in conjunction together to kind of help the patient really get the full benefit of therapy. As I had mentioned before, there are some downsides to using medication, specifically in the first class of medications you see here, which is benzodiazepine. medications, and they're basically sedatives that really take a person who's really keyed up and on edge and feeling anxious and basically brings them down to a normal level or even below a normal level, so they're really sedated. And unfortunately, these medications are very addictive, and chronic use and abuse has serious repercussions such as seizures and things like that. So doctors tend to actually prescribe antidepressants first to see if that works for their anxiety because they're not addictive and have fewer side effects. Less, fewer side effects as the first class of medications, and they're not addictive. That's the most important part here. But if the antidepressants don't work, sometimes the benzodiazepines are prescribed in conjunction with the antidepressants, or maybe the patient doesn't like the antidepressants and how they feel on it. So they will go ahead and get prescribed popular things like Xanax, Ativan, Valium, things like that. But like I said, they're very addictive, so they need to be taken seriously. So now we are at the case study portion. So as you can see here, we have a male who is 28 years old. He is a non-smoker. His blood pressure and BMI, they both look great. BMI is body mass index. And the total cholesterol and blood glucose, they both look normal as well. For family history, his mother and uncle on his mother's side both have a history of general anxiety disorder, which was important to mention because general anxiety disorder is actually inherited a lot of times and passed down within the family. His sedentary lifestyle right now is not really a huge problem because, as you can see, his blood pressure and BMI and total cholesterol, they're okay right now, but he actually wants to start exercising, so I thought that was really, really important. And for medications, he's actually on the Razapam, and that is commonly known as Ativan. And it's prescribed to only take as needed, and it's not for daily use. So that's important to mention here because if your client, let's say, has a bad day and he's really anxious and has to take his medication that day, maybe it's not the best idea to train that day. If he has to drive in to see you, he's on a heavy sedative, you're not really supposed to be driving or have any machinery or anything like that operating any machinery. So it might be the best idea to tell him to stay home that day for his best safety because you don't want to be exercising in the gym with him. And God forbid something happens to that client where basically they lose control of the weights or they're not focusing or anything like that due to the medication. So it might be a best idea to have an off day that day. For his exercise prescription, I'm going to go ahead and prescribe 20 to 60 minutes, 3 to 5 days a week of aerobic activity at a moderate intensity. For moderate intensity, what I mean by that, an example would be like a light jog on a treadmill, or you can do a light cycling, swimming, brisk walking, whatever form really best interests you, that's perfect. And then for resistance training, we're going to go ahead and do 2 days a week, targeting each muscle group, 2 to 3 sets, 10 to 15 reps. Again, at moderate intensity, so if you can lift the weight 10 to 15 times, you've reached moderate intensity. For flexibility, we're going to go for 3 days a week for 10 minutes, holding the stretch at 10 to 30 seconds at a point of mild discomfort, and we're going to repeat that 3 to 4 times. Finally, we're going to work on balance as well, and we're going to throw this in 2 to 3 times a week during your weekly regimen, standing on one foot, walking and standing on a balance board, walking backwards, things like that to work on balance as well. For more information, you can definitely go ahead and check out these links. They have a lot of great articles on different anxiety disorders, and they're very informative. And they can actually help with lifestyle modifications as well. So you can go ahead and check these links out too if you want to do a little bit more reading on your own. And last but not least, here are my citations. So thank you very much for listening today. I hope that this presentation was informative for you and really brought to light how serious general anxiety disorder is. And like I said, for more information, definitely go check out those links. They're really great for information. And thank you for joining me today.